First of all, I couldn't imagine life without each of the different Nuance applications because it has been such a key player in each of the different areas. If you look at our physician offices and the practices, we probably have 35 practices and continue to grow, representing probably over 200 physicians. And so if you went to the office setting, one of the tools that we use in the Nuance portfolio in that setting is the network edition for front-end voice recognition. Why has that been powerful? Because then our providers can actually do their notes and then have it done by the time that the patient leaves their visit. Or if they wanted to pick up the phone and they wanted to dictate, we use our Nuance relationship to basically have that information go out and then to be transcribed by our editors in our physician practice office. And I can remember in my career, since I've been at Summit for 17 plus years, that you would have 24 and 48-hour turnaround times on reports. And then with ICD-10, we made a conscious decision as part of that effort to partner with Nuance and to move all of our NTS turnaround times to 12 hours. And then if you take that and then you look at a patient that gets admitted from the ER, our radiologists use the Nuance PowerScribe application. Those reports are available timely, which helps from a length of stay and patient safety and all those different angles. In addition, we then have the Nuance computer-assisted clinical documentation improvement. And so literally as soon as that ER report is being transcribed or edited and then it's available in the electronic medical record, the CACDI engine from Nuance is reading that and then it's suggesting if things are being missed from a clinical terminology standpoint. It's putting things out there for a nurse, one of our nurses to review. And then if they need to ask questions about that, they can go and follow up. And then we are partnering with Nuance to basically continue to do education and auditing with regards to making sure that our coders and our clinical documentation specialists have truly picked up the concepts appropriately and have learned what they needed to learn. Because I would say with ICD-10 it's continuous learning. It's not always black and white with regards to how you do ICD-10 procedural codes. Sometimes it takes multiple opinions. Sometimes you have to just continue to partner with your outside vendor like Nuance to basically make sure that we're doing those things correctly. And then if you take it further down the continuum of care and patients get discharged, we use our Nuance computer-assisted coding application to code our inpatient records and our same-day surgery records. And we've had great success with that because especially on the inpatient side, we've had good recall rates, good accuracy rates. It helps to take some of the grayness out of coding. And then we use the Nuance compliance software to basically go through and look at that. And then it helps to make sure that if we had a patient safety indicator, what do we need to do about it, investigate it, follow up on it, make sure the patient's okay. And then for any other kind of reporting or auditing things that we want to do before a bill goes out to the payer, because we want to make sure that it's accurate, we want to make sure that we can stand behind it, and we use our Nuance compliance application to do that. Some of the positives that we've seen since we went live with CDI and CACDI is that the number of new patients that our CDSs are able to see has increased, which is good. What we try to do is compare ourselves to external benchmarks. We are in one of those higher performers with regards to processing new cases. And then we monitor how many cases a CDS is actively monitoring on any given day. You pick up some new, and then you have your follow-up cases, and those metrics have looked good as well. So if you look at our 170,000 patients, it's really important for the patient to be able to know who are the sick folks, who's going to get readmitted, how can we go and how can we help them so that their life isn't disrupted through a readmission, and then really how do we care for the folks that are in our community using the tools and leveraging the tools that we have with the Nuance. The fact that our 6 nurses can basically use the Nuance portfolio to assign a working DRG and to assign geometric length of stay, we send that information out to our care managers so that they can proactively be looking at how long a patient should be in, when do they need to start discharge planning. We use that information to get it to our CHF coordinator and our sepsis coordinator so that they can actually see which patients are in-house, because then that engine is able to read through those reports and able to give folks a heads up much more quickly in the life cycle of the patient that's there, which then hopefully enables us to make sure that we're following the right order sets and we're giving excellent care to the patient in a safe way. The fact that on the inpatient side, if the coder has a question about what the clinical documentation specialist saw, because you have it in one platform, you can easily just click on that tab, go see the notes from the clinical documentation specialist. And it's very nice because then it ties that all together in a nice uniform way. So it's clearly a beginning to end solution, and I think that's what is one of the most salient points about our relationship strategically with Nuance.